Welcome to another episode of Health Talk from Marz. It's out of this world. In today's episode, I want to talk about hypothyroidism and its effect on weight gain and other pathologies. So stay tuned. Hypothyroidism is an extremely common condition that, by some estimates, range from 1 to 4% of our population in the United States has either moderate to severe hypothyroidism, and another 10% has either mild or just subclinical hypothyroidism. Subclinical hypothyroidism is a borderline condition in which people have symptoms but aren't officially diagnosed according to their blood work. So there are two basic forms of hypothyroidism. There is primary and secondary hypothyroidism. So primary hypothyroidism affects the thyroid gland itself, whereas secondary hypothyroidism affects the pituitary gland or the hypothalamus. So the hypothalamus is the master in determining what your thyroid should be doing. So it sends messages down to the pituitary gland, says, hey, tell that thyroid gland to start making more thyroid hormone. So the pituitary gland then releases something called thyroid stimulating hormone that sends a message to the thyroid gland to make more thyroid hormone, both T4 and T3. So there's two basic forms of thyroid hormone. One, T4, is otherwise known as thyroxine, and then T3 is another form of thyroid that's considered to be the more active thyroid hormone, and that's triiodothyronine. So what causes either primary or secondary hypothyroidism? Well, there's a number of different postulates, and one of the postulate is that the thyroid gland is very sensitive to environmental toxicants. So the thyroid gland, especially heavy metals such as mercury, can affect the function of the thyroid gland itself. Also, there are a number of environmental toxicants that are endocrine disruptors at levels of parts per billion. So they can affect both the pituitary gland and also the hypothalamus. Also, trauma, head trauma, can also cause problems with the pituitary gland or the hypothalamus. And that can have an effect, of course, preventing the thyroid gland from getting the proper messages as far as making thyroid hormone. Estimates are 1 billion people have problems with their thyroid function due to one, a possibility of being deficient in iodine, or two, being exposed to goitrogenic substances. Goitrogenic substances are compounds found in certain foods, particularly the cabbage family or the brassica family, and these foods can inhibit the normal function of the thyroid gland. Also, low levels of iodine, since the body needs to have a certain level of iodine to produce thyroid hormones. So T4 has 4 molecules of iodine, whereas T3 has 3 molecules of iodine in it. So people worldwide that are exposed to these goitrogenic substances, and sometimes these goitrogenic substances can be found in water. So certain bacteria like E. coli may contain certain goitrogenic substances that can affect thyroid function. So must be aware that there are, possibility of foods, especially these goitrogenic foods are found in raw foods. Goitrogenic substances tend to be deactivated when a food is soaked or cooked for any length of time. So it would involve specifically eating foods that contain goitrogenic substances that are found in raw states. So if someone was juicing them, let's say, that could have an effect if they were consuming enough of these goitrogenic substances. Okay, so I'd like to go over some of the classic symptoms related to hypothyroidism, of which there are very much many. Fatigue is probably the biggest one. So when I see people come in and they tell me that after a full night's sleep, they still feel exhausted when they wake up in the morning, that's kind of a classic. So fatigue is going to be definitely one of the most primary symptoms that are associated with low thyroid function. Weight gain, especially weight gain, where people say, I really don't eat very much. I've been dieting and yet I still can't lose weight. Those are classic signs that the thyroid function is low. Headaches, migraine headaches. Migraine headaches are frequently a result of low thyroid function. So this is something that's very true. I had a patient recently who had migraine headaches almost every day for over a year. And they came in, they were definitely overweight, and they had other classic signs and symptoms of low thyroid function. Needless to say, we put this woman immediately on thyroid medication. Ringing in the ears is another common symptom. Dizziness, joint pain. So joint pain all over the body. Stiffness, that's classically can be related to low thyroid function. Symptoms of depression or just, or a lack of, motivation or just inability to get sexually aroused. So a very low libido, classic signs and symptoms of low thyroid function. Heart problems. We know that low thyroid function results in high levels of cholesterol, high levels of triglycerides. So if we see cardiovascular symptoms, classically going to result in possible palpitations of the heart and also lead to problems with low pulse rate. So if I see someone's pulse rate less than 60 and they're not much of an athlete, that's a classic sign of low thyroid function. Coldness, intolerance to cold temperatures is another classic sign of low thyroid function. So people that tend to have Raynaud's syndrome, where it's cold hands, and this is something when they're exposed to cold water, that can be related to low thyroid function. Also, heat intolerance. So people that don't tolerate heat very well also could be related to low thyroid function. Poor memory, forgetfulness, spaciness, slowness of the mind, inability to concentrate can also be classic signs and symptoms of low thyroid function. So everything slows down in low thyroid function. Your digestive tract slows down, so you tend to get constipated. You tend to have inability to digest food very well. So everything slows down, including the level of hydrochloric acid that you're making from your stomach and including pancreatic enzymes. So think of your thyroid gland as a master gland. It's like batteries for the rest of your body. If the thyroid gland runs low, everything else is going to slow down. So including your mind and your digestive tract. So those are classic signs and symptoms. Swelling of the extremities. We can consider swelling in the face. So hypothyroidism is sometimes also referred to as myxedema. Myxedema is swelling in the face. So you get swelling on the lower eyelids and just puffiness all over. And then, as I mentioned, you can retain fluid down in the ankles, the lower extremities. Difficult breathing, hoarseness of your voice, changes in the voice, um, problems with vision, especially when we see people that have problems with their vision, where they constantly are going in to get their glasses readjusted, and then they have to go back in a couple months later. Those are classic signs that the thyroid function is low, and that should definitely there should be a very strong look. Allergies, frequent colds. So when the thyroid's low, your immune system slows down. Your ability to fight off infections gets less. So the skin gets dry. You can get itchiness inside the ears. You can develop fungal infections, but dryness of the skin classically is related to low thyroid function. Part of that has to do with the thyroid gland is responsible for releasing vitamin A that's stored in the liver. So if the thyroid is low, the ability of the body to mobilize vitamin A to supply epithelial tissues becomes much more hindered. Classically, in the back of the arms, you see something called follicular hyperkeratosis, which looks like goose flesh, and this can also appear on the buttocks and also the thighs is very common. Coarse or fine hair or loss of hair. So hair loss is a classic sign that the thyroid is low. So when people tell me that their hair is falling out at an alarming rate, that's something that definitely I want to pay attention to. So low basal temperature is classically, and that's something that we're going to use to measure thyroid function. We want to know what someone's temperature is because your thyroid regulates 50% of your basal metabolism. As I mentioned, cold hands, cold feet classically relate to low thyroid function. Pallor of the skin, so where the skin gets sort of not much color, because low thyroid function can also lead to anemia. So low blood pressure or high blood pressure can both be related to hypothyroidism. Classically, when the blood pressure is really low, along with low pulse rate, those are classic symptoms of low thyroid function. So a heart rate below 60 in a non-athlete is definitely something to look at. Slow growing fingernails, fingernails with ridges, fingernails that don't grow and they chip easily and they break off and they're brittle. That's another classic low thyroid sign. So low thyroid leads to problems with essential fatty acid metabolism, where the essential fatty acids aren't getting into the tissues. So in females, what we see, especially during menstruation, is long menstrual cycles. So long menstrual cycles such as menorrhagia. So menorrhagia is where you have heavy menstrual bleeding. So it could be a long cycle where the period might last, 7, 8 days, and there could be long levels or high levels of bleeding. So classically, so lack of periods or skipped periods, also a sign of low thyroid function. Miscarriages is a classic sign of low thyroid function. Inability to get pregnant or infertility classically can be related to low thyroid function. Preeclampsia, which is toxemia of pregnancy, where women in pregnancy, they develop high blood pressure, they develop edema down in the lower extremities, they have protein in their urine. Those are classic signs of preeclampsia that can be related to low thyroid function. So when we look at menstrual cycles and we look at premenstrual symptoms such as depression, irritability, inability to concentrate, just headaches, swelling of the breasts, just these are fluid retention classically relates to low thyroid function. So if you have a lot of symptoms related to premenstrual symptoms, that could be related to low thyroid function. Dysmenorrhea or cramping during menstrual cycles, another classic sign that could be related to low thyroid function. So I hope I've given you a good list of all of these symptoms to look for, but you don't have to have all of these symptoms. You can have some or part of these symptoms and still have low thyroid function. Most physicians feel like if someone's put on thyroid medication, that they need to be on thyroid medication for the rest of their lives. I would disagree with this. I would say that I think it's really important that you need to find out why someone has low thyroid function. In the case of the Wilson syndrome protocol, one of the beauties is that you take someone on a cycle of the activated thyroid hormone, the T3, you peak them and you have them come back down. When you get to the end of the cycle, that cycle can be repeated again. And depending upon the person's response to the first cycle, they may not require quite as high a dosage on the second go around. And so the beauty is that once you get the body used to having the activated T3 hormone, the body can start to generate and activate its 5-deiodinase enzyme, so that it makes that conversion of T4 into T3. In the case of other thyroid medications, such as Armour Thyroid or any USP thyroid medication, what we see is that if we find the cause of why someone has low thyroid function, and that could be looking for heavy metals, it could be treating their adrenal function, it could be readjusting other hormones such as DHEA, dihydroepiandrosterone, we can actually get people to come off of their thyroid medication. So I think this is important to educate patients and to know that this is not a lifetime sentence that they have to take this thyroid medication. And we should always look for things that we can do to remedy the situation, to get them off their thyroid. So I'd like to talk to you about various nutrients that the thyroid uses to basically make thyroid hormone. So the first of which, of course, iodine. So it's really important to make sure someone has enough iodine in their system. So as I mentioned previously, your thyroid hormone is consisting of, like T4 has got 4 molecules of iodine on there, whereas T3 has 3 molecules of iodine on there. So that's the difference between those two. So compounds that are also included, tyrosine. Tyrosine is a critical amino acid that the body uses to make thyroid hormone. So it basically plugs 2 tyrosine molecules together, and that's where the iodine's attached to. So if you're wanting to make sure that someone has enough tyrosine, you can supplement anywhere from 500 milligrams to 3 or 4 grams of tyrosine a day. So tyrosine is also an amino acid that the body uses to synthesize norepinephrine and epinephrine. So it's really an important amino acid. I used to use it while doing triathlons. I would take tyrosine beforehand as a supplement to, maximize my output of adrenal hormones. So keep that in mind, that, tyrosine and iodine, probably the 2 most critical nutrients. Also, zinc and selenium are also involved in making thyroid hormone. So selenium is something that's near and dear because it's a precursor to glutathione peroxidase, so it acts as a detoxifier. But we also know that selenium is critical for the iodination of thyroid hormone. Without enough selenium, you're not going to make your thyroid hormones. Zinc, as I mentioned, is also important. 30 milligrams, 15 to 30 milligrams a day would be sufficient. And then also copper. So making sure if you're doing long-term supplementation of zinc, make sure you have some copper. I usually recommend at least a 30-to-1 ratio of zinc to copper. So if you're doing 30 milligrams of zinc, 1 milligram of copper should do. Okay, so those are the main supplements that we would use to try to enhance production of thyroid hormone in the body. But again, we want to look at environmental toxicants and especially amalgams. So amalgams, those are fillings that they sometimes are referred to as silver fillings, which are composed of 55% mercury. There's an organization, the International Academy of Oral and Medical Toxicology. You can go on their website and look at them, and they have some fascinating videos where they show the gassing off of amalgams, the mercury vapor that comes off of them. So if you do have a number of fillings in your mouth, or even just a few, that could be enough to give you a toxic dose of mercury. And so I think it's critical to make sure that you remove these amalgams out of the mouth. And you want to have it done by someone that knows what they're doing. Just taking out a mercury amalgam by grinding them out can make the situation much worse. So you want to make sure you have someone that's knowledgeable at taking out mercury amalgams and not just grinding them out. So we mentioned about the adrenal function is critical for proper, thyroid function. And that's something that doing constitutional hydrotherapy has been shown to be effective to enhance adrenal function and also thyroid function. So that's a whole subject in itself, hydrotherapy and constitutional hydrotherapy. I think, making sure that in someone's diet, it's been, I think, overstated about goitrogens, but if you're eating a bunch of raw foods, that's definitely something that you should take a look into if you're eating foods high in goitrogenic substances. And there's a list of foods. I mentioned the brassica family, such as sweet potatoes and cabbage and Brussels sprouts and broccoli, can have significant amounts of these goitrogenic substances, of which, again, if you cook these foods, you're going to deactivate these goitrogenic substances. So more has to do if you're eating raw foods. So sometimes soy is implicated as one of those goitrogenic foods, and it can be, but most people, tofu, for example, is processed and cooked, so there's not going to be any goitrogenic substances in tofu. Thanks for watching another episode of Health Talk from Mars. It's out of this world. If you like what you heard, click like and subscribe below. And you can go to my website, marsnutrition.net, and check out our products over there. So thanks again for watching.